Hello, gentlemen. If you've crossed 50, 60, or even older, and lately you've realized something strange is happening during your most private moments, you reach that peak of pleasure, that climax you've always known, but suddenly there's nothing there, no fluid, no release, then what I'm about to share could change everything for you. Maybe it shocked you the first time, your heart dropped, you felt panic creep in, or maybe it's been happening quietly for weeks, months even, and you've been carrying this secret alone, wondering if something is seriously wrong with you, if this is the beginning of the end. I'm Dr. Emily Carter, a urologist who has spent over a decade working exclusively with men navigating the changes that come with age, particularly in the areas of sexual health and vitality. And today, I need to have an honest, compassionate, and incredibly important conversation with you. Here's what I need you to hear right now. What you're experiencing does not mean you're broken. It doesn't mean your manhood is slipping away or that intimacy is no longer part of your future. Think about it this way. Your body isn't giving up on you. It's trying to tell you something. And once we decode that message together, you'll realize there's a path forward. So stay right here with me, because over the next several minutes, we're going to uncover the real reasons this happens, the warning signs you absolutely must not ignore, and the proven solutions that can bring back your confidence, your peace of mind, and your sense of control. But before we get into why the fluid disappears, let's quickly understand how things are supposed to work when everything is running smoothly. Imagine your reproductive system as a finely tuned machine, like a relay race where every runner has to pass the baton perfectly. Your testicles create the sperm, your seminal vesicles produce most of the fluid that carries it, your prostate gland adds its own protective liquid. All of this gets mixed together and held in the urethra, ready to go. Then, when you reach climax, certain muscles squeeze in a strong, coordinated rhythm, pushing that entire mixture out through your body. It's fast, automatic, and controlled by a brilliant partnership between your nerves, glands, and muscles. Now, here's something most men don't know. Climax and ejaculation are not the same event. Climax is the fireworks in your brain, the intense wave of pleasure controlled by your nervous system. Ejaculation is the physical act of releasing the fluid. For most of your life, they've happened together so seamlessly you never even thought about them as two separate things. But they are. They're controlled by different systems. And today, we're talking specifically about dry ejaculation. That's the medical term for when you reach that climax, you feel the pleasure, but there's little to nothing coming out. Some men describe it to me as feeling hollow, like something essential is missing. And I understand why that's terrifying. You've always seen a physical sign of what just happened. But here's the truth. Your ability to feel that pleasure is still there, still working, governed by your brain and nerves. What's changed is the delivery system, the plumbing. This doesn't mean you've lost anything that makes you a man. It means there's a specific, fixable reason behind this shift. Quick moment before we continue. If this information is resonating with you, do me a favor and hit that like button so this video can reach more men who need it. Subscribe to stay connected with our growing family of men looking out for each other. And drop a comment below. Where in the world are you watching from right now? I love seeing men from every corner of the globe coming together. All right, let's break down the three main reasons this happens. Understanding the cause is how you take back control. Number 1, the gate is stuck open. Retrograde ejaculation. This is the most common culprit by far. Here's how it works. Think of a tiny muscular door at the base of your bladder. During climax, this door is supposed to slam shut, forcing the fluid to go in only one direction, forward and out. But if that door doesn't close properly, if it stays relaxed, the fluid takes the easier path backward into your bladder instead. You still feel everything, the full intensity of climax, but because the fluid isn't exiting your body, there's nothing to see. The telltale sign. One harmless clue many men notice is that their urine looks foggy or milky right after being intimate. That's because the fluid mixed into the bladder. Why does this happen? Often, it's the result of surgeries on the prostate or bladder. The surgery itself was successful and necessary, but it can accidentally affect the tiny nerves that control that door. It's also a side effect of certain medications, especially those for high blood pressure or enlarged prostate. The medication does its job on your blood vessels, but it also relaxes that critical muscle. I once worked with a gentleman who came to me devastated after prostate surgery. He thought his life was over. But when I explained it was simply a mechanical issue, like a valve that doesn't close anymore, and that his desire, his ability to feel pleasure, none of that was damaged, he literally cried with relief. Number 2, the pipes are clogged. Duct obstruction. The second major cause is a blockage somewhere along the pathway the fluid travels. Here's the picture. Your glands are still making the fluid just fine. They're working normally. But imagine the tubes that carry the fluid are like small pipes. If something is blocking those pipes, the delivery can't happen. The volume drops dramatically or disappears completely, even though production is perfectly normal. What causes blockages? Sometimes it's scar tissue left behind from old infections, like severe prostatitis that wasn't treated properly. In rare cases, tiny calcium deposits, almost like little stones, can form and block the passage. What does it feel like? Some men notice a mild ache in the pelvic area during climax. Others realize the fluid has been getting thicker or less over time, slowly, almost unnoticeably. The good news? Many of these blockages can be cleared, sometimes with medication to reduce inflammation, sometimes with simple, minimally invasive procedures that restore normal flow. Number 3, the engine is running low. Hormonal imbalance. The third major factor is hormones, specifically testosterone. Here's why it matters. Testosterone isn't just about desire or making sperm. It's the fuel that keeps your prostate and seminal vesicles functioning at full capacity. These are the glands that create most of your fluid. When testosterone drops significantly, the whole system slows down. What happens first? You might notice less fluid than before. But as time goes on, you might also feel less interested in intimacy. Erections might be softer, and climax might feel less powerful. Beyond that, men often experience exhaustion, mood swings, loss of muscle, even mental fog. The solution? This condition is called hypogonadism, and it's treatable. A simple blood test can confirm it. If your levels are low, carefully supervised hormone replacement therapy can restore not just fluid production, but energy, desire, and overall vitality. Don't just accept this as aging. Now, while most causes are manageable, I have to be clear about the serious exceptions. Sometimes, dry ejaculation is a warning sign of something more urgent, which is why paying attention to other symptoms is critical. When you need to see a doctor immediately. If this started suddenly with no explanation, especially if you're also experiencing pain, blood in your urine or fluid, fever, or numbness in the genital area, do not ignore it. These are red flags that demand urgent urological attention. Conditions like Parkinson's disease, poorly controlled diabetes, or in rare cases, certain urological cancers can disrupt the nerves or plumbing involved. The emotional side we can't ignore. Let's talk about what this does to you emotionally. Many men tie their sense of masculinity directly to the presence of that fluid. When it's gone, feelings of shame, fear, and inadequacy flood in. It's common for men to start pulling away from intimacy entirely, afraid of being judged or feeling like they've failed. Here's the emotional truth. The first step to breaking free from this cycle is understanding and communication. Once you realize this is a physical change, not a character flaw, an enormous burden lifts. Your ability to feel pleasure, to have erections, to connect with your partner,